Hi, welcome to Vitalize Health Partners. Thanks for being here. And today we're going to talk about things that will help you get better care by your doctor. And when I see patients in my office, I so appreciate when patients do these things. I thought I would share them with you so you can be prepared when you see your doctor or your medical provider. So at Vitalize Health Partners, our goal is education. We want to give our patient the best information that's out there right now that is unbiased, right? Because the last few years have been crazy. People don't trust their doctors anymore. We want to kind of help turn that around a little bit, right? So, thanks for being here. And we're going to go through that. By the way, if you do want a one on one consult, say you have questions that aren't being answered here, you can go to our website, vitalizehealthpartners.com, and schedule a one to one consult with our health coach. Health coach Erin. And then you'll also get a follow up appointment online with me, Dr. Andrew O'Connor, just to answer your questions. I'm not acting as your doctor, but I'm all about giving information and education. All right, so let's go. How can you get better care by your doctor? So, the number one thing is, oh my gosh, be on time. Now, I'm not saying that your doctor's not on time. Sometimes things happen in the office, it's an emergency, and it can go over. It's happened to me too. But for the most part, I try to be on time. And if I have a patient running kind of late, I let them know, like, well, your visit's going to be smaller because I'm not going to make the rest of the day late. So just be on time. Maybe map out the route so you know how to get to your doctor. You know where their suite is. If there's a long check-in process, make time for that, right? That to me seems like a no-brainer. Just make time for your appointment, right? I love when patients do this. Bringing lists. Yes, please bring me a list of your medications and supplements. Do not forget about herbs and vitamins, right? Because natural things, natural herbs and supplements can affect how other medications work. Many herbal medications are extremely strong. So a list of your vitamins, supplements, herbs, and your medications, because it changes a lot, right? And it all matters. I love when patients just bring me a list of that. So when we're talking, I can be perusing the list. And then we can update it in your chart. That's always a good thing. And I also love when patients bring me a copy of their lab work. Say they went to the emergency room or urgent care, or they saw their specialist and had labs done that I didn't order. And I love when they bring copies of it because unfortunately, some patients come in because everything's online now, right? And they're like, well, there's a patient portal, and they bring up the portal, then they try to send me the link, and guess what? I can't open the link, or it needs this password, and it just takes forever just to get into it. So I love when they print it out. Print out your lab work, or if you can just transcribe it and write it down on a piece of paper, like if you don't have a printer. I appreciate that so much. And maybe if you can't do those things, doing a screenshot with your phone of your lab results and just bringing that with you. It's so easy just to bring it up on your phone. And it makes taking care of the patient so much better. And it'll be better for you because if I see what labs are drawn, I know what they haven't had done. I know what the follow-up needs. And we're not wasting 20 minutes of the patient's visit trying to find their labs that they had done. So that's a really good thing to bring on your visit. Even if you don't think it's important, just bring it anyway. Just bring it anyway. Okay. Family records. I do love when patients tell me about their family history, but I don't want to take up all that time on the visit. So I love when they just make an outline of, hey, my father died of congestive heart failure, my mother had breast cancer. And when they create a list like that, I know certain things that I need to keep an extra eye on with my patient because a lot of things run in families, right? So instead of talking those through, if they make an outline of family history, I love that because usually on the first visit or the intake, we're asking about family history, but how many of you had your provider really do a deep dive and ask you all the questions about your family history? You probably have so much more information that could be very helpful. Did you know that trauma and what's the other word for that? Trauma, abuse, I guess I'll say. Do you know that genetically can be passed down to family members? It's called epigenetics. So when I have a patient that tells me, and there's books written about it, written about epigenetics that survivors of the Holocaust in World War II, a lot of those people that survived and ended up having children, that trauma was passed down. Not only that, people that survived their experience of being starved and abused and all that, a lot of them ended up living a very, very long life because it lengthened their telomeres. So again, knowing that family history, it affects how we figure out the roadmap to your healthcare. It's really, really important. Okay, so then I'll have patients say they bring their big bag of medications, which I get it. I would do the same thing, right? It depends on your doctor. I don't find it as helpful because digging out all those supplements and looking at the labels, looking at the ingredients, that takes up so much of the visit. It would be more efficient for you as the patient that's paying for the visit. Just create a list of everything you have in that bag. And don't forget to look at expiration dates because we don't want you taking a supplement or a medication that is expired. Many things last longer than the shelf life they put on there. But for the most part, for medications, there's like certain antibiotics that can actually turn deadly if you take them when they're expired. So it's a good rule of thumb. Don't take expired medications. Okay. Other things that are helpful. Are you guys taking notes? If you're taking notes, that leads me to my next one. Bring a notebook or a journal. And why not just tape record your doctor? I say tape record. I'm so old-fashioned, right? Or record from your iPhone. Well, it depends on your provider. If my patients want to record me with their iPhone or whatever their phone, I certainly let them. I've got nothing to hide. Not every provider feels that way. They feel a little intimidated. And then the conversation might not be as open and people might get a little bit afraid of being recorded. And it may just be like a subconscious thing. They're not meaning to do anything subversive, but they might feel intimidated being recorded. So keep it friendly, right? Bring a notebook or a journal and take notes. It's a really good idea. I have a lot of patients that will do that. They'll have some sticky notes. They'll have index cards. They'll have their notepad. I think that's a really good idea. But I do let them record me too because I do think it's helpful to listen because I do hour-long intakes and visits and I talk a lot, obviously. So it's just good to have all that information. It's just another good tip. So, and don't forget, depending on your doctor, now, I have the luxury, I'm an integrative naturopathic practitioner. I am a naturopathic medical doctor, and I have the luxury of spending a long time with my patients because I don't take insurance. Well, so that's one thing. But if your doctor takes insurance and they have to see you within 15 minutes, they're not going to be able to safely treat 3 different complaints that you have. It's just how it is. They're not going to be able to do that. So, you want to record any current issues and symptoms. So even if you can't, remember everything that's going on, say the one complaint, they address it really quick. It's like, okay, I can order some lab work for that. Say someone comes in and they're worried about their thyroid. Got you. I will order you this thyroid panel. We talk about that. Well, that was done pretty quick. So if you have a little sticky note of your current issues and symptoms, it's a really good thing to refer to. Don't open a big notebook, but for taking notes, it's great. And read like a long paragraph. It's just going to eat up your time. Come with that sticky note on your notebook, like, here's my current issues and my worries, because then you can get in more questions if you only have that 15-minute visit, which, I'm not a huge fan of anyway, but some people, they see doctors with insurance and they don't really have a choice. So what I always tell patients too is when I'm asking a question, for example, with pain, okay, I've been having a lot of pain. Well, what do we want to know? Was it sudden, gradual, chronic? Is it better with standing, lifting, twisting, sitting? Does anything help, like heat, cold, medication? Does anything help? These are the questions guaranteed are asked anytime you're having new or unusual pain. So just be prepared with the answers. You could just have it on an outline because a lot of times they'll be like, well, let me think about that. Again, you're just eating up time. And I'm only telling you this because it's going to help your care. Again, if you have the luxury of seeing a doctor and they sit down with you for an hour, that's another thing, right? Yeah. Other things we ask, the quality of the pain. Is it throbbing, dull, aching, sharp? Where is it located? Does it stem to other parts of the body, or does it travel? What is your pain on a level of 1 to 10, 1 being the least, 10 being the worst? If you know these questions beforehand, you can already have the answers ready. I think that's really helpful. So those are just, some helpful tips of, how you can be prepared as you walk in to see your doctor. And and so if you think that you have a ton of questions that your doctor can't answer, feel free to go to our website and schedule a one-to-one consult. The price or the fee for one visit includes our health coach, Erin, talking you at length, and then with me where I can answer your medical questions. Again, I'm not going to be acting as your doctor, but I will be educating you because I am a doctor and I see patients every day. I do work 7 days a week, and I'm happy to answer questions like, hey, I don't understand. What did my doctor mean by this? Or what does this medication do? Or what does my diagnosis mean? Education. It's really great to have that. Okay, thanks for being here.